Okay, I think we are ready to proceed with our agenda then. First with us is going to be Joseph Hum from the Lake County Emergency Management Agency, and he'll be providing an update on things over at the EMA. Joe?
Thanks, Jessica. Can everybody hear me and see me okay? I hope. I know there's a little bit of background. It may pop up as Joe Busher. He is the director of the EMA. I am stepping in for him as he is currently moving and off this week. So to introduce myself, for those that don't know me, I am the deputy director for the Lake County Emergency Management Agency. I've been there since 2014. I started with the planning side with hazmat, doing hazmat stuff throughout the county. In 2018, John Church, my predecessor, retired, and Larry Green had asked me if I was interested in stepping into the position. So I became the deputy director in 2018. I've worked in just about every facet of the emergency world. I was a 911 dispatcher for more than 14 years, firefighter paramedic for the city of Willoughby for the past 15 years. That's where I currently work full-time and then part-time with the EMA. One of my main goals that I handle is Vesta Alert. Vesta is what we would actually use for call-outs for the nuclear power plants, for S&S activations and pod stuff that would come through the general health district. If we needed to activate any of that, that would come through our Vesta system. We also use it, the county, for the reverse 911. So one of the things they asked me to talk about tonight was the EMA, giving you an update of what's going on with the EMA and some of our role with this COVID-19 and the response that we've had. The EMA has been part of the unified command between the General Health District, Emergency Management Agency, and the county. EMA Director Busher has sat as the one of the heads, along with Ron Graham and Jason Boyd. Some of the things that we've done from the EMA is PPE, inventory and distribution. We've been the main receivers of PPE for Lake County. To date, we've received more than 500,000 pieces of PPE, from gowns to gloves to masks. Right now, we are currently housing what the state requested to be a 3-month stockpile for the county. And this includes anything from EMS and first responders. We're supplying the hospital system, nursing homes, long-term care facilities. Now, more recently, as PPE is becoming more readily available, they are starting to stand on their own. So we're more focused on the first responders and volunteers and things like that throughout the county. Some other things that we do is interact directly with Ohio EMA. We put up all the mission requests for testing materials and things for the hospital system, and we handle the ICS management. Myself is one of the what we like to call NIMS nerds in the county, handles all the ICS forms and completion of forms and all the documentations and logging. That way, when monies become available for reimbursement as well, we're able to get those. Some of the changing roles for the EMA and the EOC due to COVID, one of the big things obviously has been social distancing, and it's hard for those that have seen the EOC or have been into the operations room there. That room usually can have anywhere from 35 to 50 plus people, and it's very hard to socially distance in such a small room. So one of the things that we had to do on our end at the EMA was go to a more virtual environment, which included not only computers and doing trainings and things like this, but also working with different agencies throughout the county that could not come into the EOC now, and being able to figure out a way to connect them and work with them on a more daily basis using emails and GoToMeeting, Cisco WebEx, Zoom, and the different platforms like that. So with that now came some things that we recognize were deficiencies in how we operate the Emergency Operations Center. I mean, we've always been a very paper and pencil type of setup, and for those that have participated in the nuclear power plant drills that Jerome's gonna speak to and stuff, you know how we transferred everything via paper in there. So one of the things that we've now had to do is do some major upgrades to the Emergency Operations Center. And we're currently undergoing those as we speak. Close to $100,000 upgrade to do the new audiovisual, making it so that we can do phone conferencing through the entire room. coming over the speakers, putting in multiple microphones that people can use when we do have to bring in a skeleton crew to run the EOC, but have to work outside as well with other agencies like the school district or the schools, excuse me, and working with them through their offices, or Job and Family Services now working from their offices, or even like this where we're coming to you from our own homes, where we're able to talk to the people in the EOC and interact in a fashion that doesn't have us in that 6-foot social distancing circle. So we're doing the network upgrades, we're doing those technology upgrades, and also we're looking, hopefully, once COVID does kind of become contained and we hopefully have a vaccine for it, and we can start getting back together again, we also will have a brand new training center in there now with state-of-the-art projectors and things that will be able to bring even better trainings. And hopefully next year, when we're able to do this together again, you'll be able to see the new center and the new training and stuff. So that's really all I have from the EMA. Does anybody have any questions for me?
We will hear from our health commissioner, Ron Graham, who will give an update for the health district. Ron?
Yes, hello everybody. Ron Graham, health commissioner for the Lake County Health District. Been up here in Lake County since 2007. Been health commissioner since 2015. When you go to school for dietetics and public health, you don't realize you're going to be dealing with train derailments and floods, Ebola, COVID. You always read about it, you just don't really, hope you don't have the experience to get in there and be stuck with that. But here we are, we're doing very well as a county. And I want to thank everybody again for the opportunity to serve as health commissioner. And so a little bit about what my day's like. Early on in this event, legal is very clear that everything kind of begins and ends with the health department during a public health emergency. And then when I thought we'd go to the EMA and the Emergency Management Agency and sit with our buddies at the Emergency Operations Center, we'd have a lot of support. And that was very different in this emergency, and it still is. Joe did a very good job of covering how we overcame those challenges and worked remotely. So on any given day now, I'm either the angel of death for opening a facility or allowing a business to operate, or I'm somebody's savior and they want me to get fireworks back on the schedule here. So it's been pretty interesting to go from sewage to syphilis and anthrax to Zika, front of the light, right up front center. We're successful only because of our friends and our partnerships. Many of those are on the phone today. Kristen Kane, Jerome, Joe, board members, community leaders, have been excellent at communication. I can't believe how well it's been. Everybody's been very level-headed. We try to use common sense in Lake County. Being a very educated and a more affluent county, we're somewhat insulated. A lot of key leaders, very educated leaders, innovative leaders in the county, has really allowed us to, step out and maybe approve a few things for a community that normally would not be, with little pushback from the state. And just really trying to use common sense and get everybody back. It's a balance of, is the disease worse than the cure? And from one standpoint, we could lock everything down and prevent the disease, but we'd always have it looming behind us. It's kind of a balance of getting some immunity in the community, not overwhelming the system, getting the vaccine produced, getting the economics rolling, and really, from an ethical standpoint, it's been the most challenging thing to go from personal safety and public health to economic and finance, and how's that really going to pan out for everybody. Can't thank our nurses enough. The nurses have really put together just long days, long nights, 7 days a week for a while, doing the case investigation, working with individuals that are very concerned about their parents, their children, newborns, the whole spectrum, and contact tracing, which is just really, getting down and getting the nuts and bolts of where everybody's been for the last 7 days. I can only imagine those challenges. I forget what I eat for breakfast. Working remotely, we've had challenges with the staff. I don't know what day it is sometimes. So we're all putting in about 60 hours a week, which is really not bad when we've had everybody supporting us and getting the work from the home environment, which was kind of wonderful at first and challenging as you go further into it. But flexing between the office and back. Isolation and quarantine, we danced on the line with having to mandate that. That's a huge issue. It's never really been addressed. If we quarantine somebody as you know, we would kind of keep them in their home or an apartment or a hospital, and public health becomes responsible for everything in that household, their food, their finance, their medical care. So as much as we'd love to do that, we're not really equipped to run hospitals or households. And so we've really, with the homeless population, really did everything we could, as creatively as we could, to kind of keep out of that zone. We don't want to be a militant health district, a militant government coming and telling you what you have to do. So it's really been an interesting time. Maybe COVID-19 is now equal to politics and religions. It's very difficult to have a conversation of what we should do. From the governor, was he right or wrong? Dr. Acton, right or wrong? And as you know, there's several court cases originating out of Lake County based on some of the efforts from the governor and what we've rolled out as public health. I think one of the big successes we've had is the public information. We've had meet originally almost daily, weekly now with the fire chiefs, the emergency management agency, the hospital, mayors and managers. So my butt is getting fatter as I sit in this chair, but my ears are getting bigger from the phone calls. But really, the communication has been phenomenal. And again, it's been public information, social media. Again, every partner on here with an agency, and it's the Medical Reserve Corps and the Citizens Corps, you're going to be our voice as well. And so we really locked down the media, push media out versus having them come to us, and to control that narrative, maximize social media, website, technological advances, reformatting our Motivate Lake County Wellness Program to be more of an assessment and facilitation site, which is working on. Environmental health is really our bulk of the center for us. So on the side of contact tracing, we've also received probably 1,500 calls in any given month period. And that has been developed to really give people guidance and reassurance on, getting down the misinformation that you could have. Multiple media really kind of distort the truth, put a lot of fear in everybody. There is a lot we do not know about COVID-19. Certainly it's very concerning on some of the long-term effects that may be there, but we really need to focus on the immediate side, which is really protecting our most at-risk population, pushing personal responsibility as things open up here. But environmental health, we're getting really into the bulk of the calls in the call center, doing the enforcement as we get complaints either through Facebook Messenger, directly online, or through email. And it's quite a task reviewing plans and putting teams together. Early on, we put a business team together to help consult with our Lake County businesses as they begin to struggle with the prolonged closure, getting back to work, just hundreds of calls on what do we do with this employee if they're exposed or potentially traveling. Just a lot of good sound advice and consistent advice. We're now kind of reviewing plans. The state has kind of kicked the can down the road as we get further into the event. So we're making more and more local decisions. And while we're not formally having to approve plans, it really is kind of what everybody wants to feel more comfortable to operate, to get that sense of control. So we really do get plans out based on the best advice we can, given the situation. Sometimes on a personal level, you think they should just be closed, but you don't have the opportunity. So you really have to kind of challenge yourself and your colleagues on decisions that come out. There will also be assigned as we move into some of the last leg of reopening with schools and senior centers. We have teams assigned to help those individuals go as we get guidance. Again, a lot of our job is that the public health system is really not just the health department. It's everyone on this call today. It's all our 23 political subdivision. It's our board of health. It's our cities, our colleagues, mental health board, just countless numbers of individuals. And so a lot of our time is really trying to just get that information out, make sure those decisions are consistent, they're logical, getting a lot of perspective and being challenged. So we work with the EMA, hospitals, nursing facilities for testing and PPE. And of course, any questions you want, we can go through that. But there's been challenges almost every step of the way that we did very well, and certainly only successful because of our partnership. We challenged our continuity of operations plan. When you burn your building down and you move to a new one, you got to build a whole new plan. Just when you build that plan, the game changes one more time with social distancing. So I have to give credit to my IT staff who quickly stood up, from usually using 10 remote laptops out in the field during a given week and going paperless kind of thing, to putting over 45 staff and 45 laptops onto a system that was not made for remote access, and doing that almost seamlessly and flawlessly to get us back to work. And how do you open to the public and and still protect your staff and provide the services you want? So we push the limits of technology on our website, online payments, and then those kind of communications that we can. And in fact, I think we're doing very, very well. We're going to continue kind of to be closed to the public with the exception of disappointments, or one individual may not really be paying attention to the news and they come on out to our facility, which is always surprising that somebody may be that isolated from news. Challenges for activating volunteers at this stage are really just what risk are we putting you on? We're remotely working and operating small caseloads, so we can help you kind of come up to speed. So that is kind of a new thing, and something we've always looked at for years, that the 65 or so employees, we know at some point in time we're going to be managing strangers. We hope those strangers become friends through MRC and Citizens Corps before we get there. But it's more and more highly likely that we'll be working with individuals that may not be our colleagues or may not be our staff, just because of the scope of the event. So this is very important for us. It's really community taking care of themselves. Larry Green always kind of had the mantra that emergency started locally, and when everybody leaves from the state or the feds, we're still here locally. So it begins and ends with us, and that is extremely true. Again, the fire department has been wonderful over the years and working with them. Law enforcement we had never really worked with before, but now we do have a lot of conversations with them from their own exposures of their staff to compliance. I know Dan Waterman calls me about every other day for some guidance for Painville City. A really great guy I had never met before. So gaining friends just almost on a daily basis. I have a couple more notes here. But well, that's probably enough for me. We're really looking at how we deliver these services, and we provided some guidance to the state on how do we vaccinate when the vaccine is here without bringing people together in a mass clinic, right? So if you take a vaccine that takes 2 weeks to really develop immunity, how do we bring people together for a disease that could be symptomatic within 5 days or 6 days on the average? So really been pushing the state a lot on challenging best practices, looking at more of a comprehensive and large critical mass to look at social media for personal responsibility, because we are not going to be able to shut down businesses. The news guidance is we're going to be looking at green, yellow, red kind of status marks for each county. If you're a green county, you kind of operate, meaning your hospitals are in good shape, you're not having a lot of deaths, you don't have a lot of new cases coming in. On the counterpart, we could be in a red community for 30 days. As this rolls out, we'll find more out Thursday and next week. If you're a red county, you may be shutting businesses back down again, or restricting school to online only. A lot of unknown in the next 14 days, really. So we're going to move quickly, and just every day we're finding out information about the same time the public does. It's really no longer do we get much of a heads up and an advance notification. So a lot of our help will be just kind of the infrastructure. It could be clinics down the road. So really could be challenging for everyone, and I cannot thank you enough for taking the time out of your evening to work with us. And I'll just turn it over for questions if you have any, or comments from the rest of the
lot has, and I've seen you. Again, I'm here at the Lake County Emergency Operations Center tonight. And I'm on with my little ticker here. So it required me to have a major surgery. And so I was out for the count for the first 4 months of the year, and right in the smack dab of COVID-19. So I'm somewhat excited to be back and to be here. And again, this is unique for me because I'm so used to standing before you guys and throwing pins and prizes out to you. So I guess we're going to have to figure out a way to get you a pin or some type of token of appreciation. But my main job tonight is to discuss a little bit about your role with the Perry Nuclear Power Plant. We're in the process of finalizing our transition or migration from First Energy to Energy Harbor. And that was actually supposed to take place, the last part of it, today. And as of tomorrow, we were supposed to have been totally separated from First Energy. And what that means is we're our own company. We no longer fall under the parent company of First Energy. Energy Harbor is a standalone company. They're also based out of Akron, Ohio. Their headquarters is downtown Akron. And they are the parent company of several generating facilities like the Perry Nuclear Power Plant, Davis-Besse, in Port Clinton, Beaver Valley, and Shippingport, Pennsylvania, and several coal-fired plants as well. So no longer are we a part of the First Energy Corporation. So this is unique to us. There's a lot of things happening. You'll be seeing a lot of marketing and advertisement about Energy Harbor soon. With that being said, let's talk a little bit about the Perry Nuclear Power Plant. Perry is still running. It is at 100% power. This is a great week for us. We're generating a lot of electricity to keep your air conditionings running. But we have to prepare for an emergency in the event something would happen. So we do that. If you can turn to the next slide, we look at a 10-mile, well, we're going to talk a little bit about our learning objectives here. The emergency planning zone, the emergency classification system, the County Emergency Operations Center, how you would be notified, and then your specific role. So looking at the 10-mile emergency planning zone, we have to prepare for people who fall within this zone. It's a 10-mile radius that surrounds the power plant. Ours is unique. It's divided into 7 different sub-areas. Sub-area 1 is North Perry. Sub-area 2 is Madison. Sub-area 3 is Perry Village and some of Painesville Township. Sub-area 4 is more of Madison. Then we affect another county, Ashtabula County, Geneva on the Lake, Geneva City. Sub-area 5 is pretty unique because it encompasses all 3 counties. Some of Lake County, the Madison area, we get into Harpersfield and Ashtabula County. And now we affect Geauga County, a little small area of Thompson. Sub-area 6, the green area, that's still in Lake County. That's Leroy and some of Concord. Sub-area 7, more of Concord, Painesville City, Painesville Township, Fairport Harbor, Grand River, and a little small section of Mentor. So we use this as a tool to determine who may be at risk. Worst case scenario, we're looking at a 10-mile radius being affected in the event we have a radiological release from the power plant. So how do we rate, or how do we classify an emergency? And let's go to the next slide. We start with a 4-tier system. We start with the unusual event, which is the least severe. We move up to the alert, site area emergency, and general emergency. Let's discuss the unusual event. So next slide. Unusual event, again, is a minor problem. There's no radiological releases that will occur. Go ahead and click that one more time. The 3 counties would be notified, Ashtabula, Geauga, Lake County, and also the state of Ohio. And some of the different ways we could enter into this particular classification would be based upon these different examples here. A fire greater than 15 minutes within the protected area of the power plant, and it would have to be near some safety systems that would cause us some major heartache. A loss of communication capabilities. We have multiple means to communicate to the outside world, and if we lose the major communications that are listed in our plan, that would place us into this classification. A loss of off-site power. So you're probably wondering, well, aren't you the power plant? Why do you need off-site power? Well, if the plant is down for a maintenance outage, we still have to keep systems cool. So we rely on electricity that's funneled through to the plant to keep those systems secure and cool. So if we lose electricity coming into the plant, this could place us into this classification. And then a natural phenomenon affecting the protected area. So that means a tornado, earthquake, a major storm that could place us into this level. You're not notified at this time. It's more of a courtesy call to the counties and to the state to let them know that it's something unusual that has happened, and that's really about it. Next slide, please. At the alert classification, it's still considered a minor issue. The 3 counties would be notified. The state would be notified. Go ahead and click it one more time. And some of the examples that we could use to, or what could happen that could place us into this classification would be a loss or challenge to a fuel barrier. We actually have 3 fuel barriers at the power plant. There are the actual rods, the fuel rods are one barrier. The reactor vessel is a second barrier, which is very thick steel. And then the third barrier will be the containment structure. We actually have 2 containment buildings. We have a metal or steel liner, and then we have a concrete barrier. If we lose one of those barriers, that would place us into this classification called the alert. A fire or an explosion affecting a safety system could place us there. Again, a natural phenomenon affecting a safe shutdown building could also place us in this classification, like a tornado or earthquake. And then notification of an airborne attack threat. So if we get a call that a plane is off course, which we're no-fly zone, but if we hear that there's a plane coming our way, we have to bunker down, we have to instantly turn the reactor off, shut it down, and take cover in the event that something like this would occur. This all came about after 9/11. At this point, this is when the EOC, the Emergency Operations Center, could be activated based upon what's going on at the power plant. We have had alerts before. It's been probably about 15 years ago since the last alert, and that was due to a faulty sensor that was in some ductwork, and it picked up some abnormal readings of radiation. We also had several other sensors in that same area that were reading perfectly fine. So we knew it was a faulty sensor, but we couldn't get to it in the amount of time that was required before activating or initiating this alert classification. All right, next slide. Site area emergency. That's the first time we actually used the word emergency. So at this point, and you go ahead and click it one more time, Jess. Site area emergency, potentially severe issue at this point. Notifications are made to the 3 counties, to the state. The EOC would be fully activated at this point, and what Joe mentioned earlier, we may be operating with a skeleton crew or maybe operating via a system like this from your homes virtually. A loss or challenge of 2 fuel barriers could place us into this classification. A failure to shut down the reactor could also place us there. A site area radiation dose exceeding limits. We're under attack. That could be an example of a site area emergency. Bad guys have penetrated all of our layers of security at the power plant, and then a loss of off-site and on-site power. So a lot of things are happening at a site area emergency. Go ahead to the next slide, please. The county's response is going to be great at this point. So if school was in session, we would be relocating schools to what's called a receiving facility or receiving school. So Perry District, if schools were fully functional at this point, they would be going to Chardon schools. Painesville City would go to Willoughby Eastlake schools. Riverside would go to Menor schools. Menor only has a couple of buildings inside of the 10-mile zone, so they would just support their own students at another facility. Fairport would go to Kirtland schools. So we move those kids out of that 10-mile emergency planning zone to another location for their parents to be able to pick them up. Preschools and daycares are going to be closing. So as you can see, again, because of COVID, a lot of this, a lot of our schools and things have been shut down for several months now. State parks are being closed. Headlands and Geneva State Park, the metro parks. And then the counties will declare a state of an emergency at this point, which will free up federal resources. Next slide, please. Fire departments will be staffing up and receiving dosimetry and setting up monitoring decon facilities. So Willoughby South, or the middle school now, the old South High School, is still one of our primary care centers. And the new North High School would be the second primary care center for Lake County. We also utilize in Geauga County Cardinal High School and Notre Dame Cathedral Latin. In Ashtabula County, we utilize Lakeside High School and Conneaut Middle School. So these facilities would be available for us to receive residents that may be evacuating from Lake County or other areas within that 10-mile emergency planning zone. Our nursing homes inside of the 10-mile emergency planning zone will be bringing in extra staff in the event that we would have to relocate some of our nursing homes to a host facility outside of that 10-mile zone. Law enforcement agencies are receiving briefings to assist with access and traffic control. And then our county public information officer will be going to the Joint Information Center that will be providing the latest and greatest of information. There's talk about doing virtual Joint Information Centers. We see it every day now since COVID on how that works, where you may be able, our spokespeople may be able to stay in their offices to give out the latest and greatest of information. So these are a lot of changes that are happening very quick. Next slide, please. And click one more time. General emergency, severe issue. If never declared, knock on wood, general emergency before, since the 3 Mile Island accident back in 1979, and that probably would not have, well, it could have been considered a general emergency. It was such a minor release that went just beyond the gate of the power plant, enough that was equivalent of a couple of x-rays. But anytime you have a release and it's strong enough to go beyond your site boundary, that's where we would come into this classification, a general emergency. The 3 counties would be notified, state would be notified, you guys would definitely be notified. Again, a loss or challenge of 3 fuel barriers, a failure to shut down and cool the reactor, off-site radiation doses are exceeding all the limits, and then the loss of physical control of the plant. Next slide, please. So a lot of things are happening. This is a bad day, a bad day. So what is the county going to do at this point? Where we're going to sound those sirens. And matter of fact, the second Wednesday of the month, the sirens will be going off in July. So at 11 o'clock. If you hear them before then, it's not a good thing unless something happens. But the sirens are going to be tested, an audible siren test on the second Wednesday at 11 o'clock of July. So if something would happen and we sounded the sirens, we were at a general emergency, this would send the red flag up for you guys to understand if it's a real or severe incident. One, the sirens would go off for 3 minutes, off for 30 seconds, 3 minutes again, off for 30 seconds, 3 minutes again, followed by an emergency alert system message, better known as an EAS message. It's the same kind of messages that you receive when we have severe weather, that this is a test. Okay, you'll hear something like that. Actually, Central Communications right here at the EOC, they would actually activate the EAS encoder that we have here, and they would read a pre-canned message over the air to alert you that something is going on. Stay tuned for further information. The public's being told to shelter in place or to evacuate. Buses, squad, wheelchair vans are being used to transport the public needing a ride, and also nursing home patients as well if we had to transfer them to another facility. Next slide, please. Law enforcement agencies are directing traffic outside of the emergency planning zone and controlling access and evacuating and access to the evacuated areas. So we want to prevent looting and that type of thing. So they're going to be providing patrols. The fire departments are setting up and operating the monitoring decon facilities that I mentioned earlier at some of our high schools. They're ensuring the public has been notified. So say, for instance, Painesville City or Fairport Harbor, we're just not going to assume that someone knows to leave. They're actually going to go around and do door-to-door, knocking on doors to ensure that people are aware that there's an emergency in progress. Also, we're going to be coordinating the use of transportation resources as well. Next slide, please. So once we declare an emergency, any one of those 4 emergencies, Perry has 15 minutes to notify the 3 counties and the state of Ohio. But during a general emergency, there are protective actions that have to be made for the general public. And Perry would make a recommendation from the power plant based upon computer data that we have. We have sensors that are located throughout the area on some of our buildings where there are vents. So we can actually determine how much of this release is coming out of the plant, how fast is it moving? We have weather stations, weather towers at the power plant. We know which way the wind is blowing, how fast it's blowing, how fast this release will actually travel to get to a municipality. So we're giving that recommendation and that information to the counties to make a decision. The state of Ohio works independently, and they're also calculating dose assessment data, and they're also giving a recommendation to the decision makers, which are the 3 county commissioners, the sheriff, and the EMA director, and they will in turn decide or make what's called a PAD, a protective action decision. Next slide, please. So once that happens, a recommendation could be to shelter in place. Do not go outside, stay inside, close your doors, shut off all air intake systems, and stay tuned to your local EAS network or emergency television station or radio station. And this recommendation should not go beyond a 4-hour time period. Next slide, please. And of course, the most obvious is to evacuate, to get out of Dodge, to leave the area. So that would be one of the major recommendations. And I could tell you now that if we ever declared a general emergency, 9 times out of 10, evacuation would probably be the recommendation for the general public. Next slide, please. You might have to hit it one more time. There you go. So the EMA, the Emergency Management Agency, they work here daily. Once they activate this facility, it becomes the Emergency Operations Center. You can go ahead and hit the next slide, please. And you have several agencies before COVID that would come here and to support a major event. Again, I talked about the executive group. They're the major decision makers, the 3 county commissioners, the sheriff, the EMA director. Then the operations group. We have Ron Graham from the health department. We have the county engineer. We have Red Cross. We have RSVP. They help us with our public inquiry, and you guys play a vital part in communicating and keeping the public at ease and answering all their questions and getting back to them. You assist us in a variety of different ways, and we really appreciate how you do that for us. So you have about 40 to 60 agencies that would respond to this facility. We're now in the process of looking at, do we need those agencies to actually come to this campus, to this location here? Can they do their job remotely? And actually, just a sidetrack, this is the year that we normally have our big drill in September. And we have received credit from FEMA on real life emergencies. So at this point, we're still waiting for the final approval that we may not have to demonstrate as much in September like we have normally had to. Based upon the COVID-19 responses that the county is in, the state of emergency that we're in, and also some of the demonstrations that took place in Lake County, that we were able to gain some real life credit for traffic and access control, some of those types of things. So more to come on that. Operations group, again, those agencies responding here, communications group, you have amateur radio, you have central communications that would assist us in communicating information out to several agencies. Next slide, please. So we covered this already. The 3 counties in the state would be notified within 15 minutes. Next slide. And the ball begins to roll. So a variety of folks get the call. We activate, as Joe mentioned earlier, the VISTA. That's a paging system. So once we declare an emergency, we have a communication tool called the 5-way. It's a conference bridge that comes from the control room at the power plant. So once we declare an emergency, they have 15 minutes to notify the 3 counties in the state. So Central, being our 7-day-a-week, 24 hours a day primary communication contact, they have that phone on one of their main consoles, and they receive that information. And once the EMA director is notified, he may say, let's activate the EOC. So through that VISTA call-out tree or call-out system, Central will actually be able to communicate and contact the 60 agencies, including RSVP, to be able to activate the EOC and to be able to come in or be told otherwise what to do. Next slide, please. So we've talked about notifications. I've killed that already. Next slide. And we've talked about the alerting system, the sirens going off. And we also do something what's called backup route alerting. And that's where if a siren was out of service for whatever the reason, believe it or not, we have people who miss the road sometime and they decide they want to drive their car or truck into one of our sirens. And so it typically takes us about, 3 days to replace that siren. We actually have some spare parts and things like that. But if that was the case, we would rely heavily on a fire department to drive up and down the roads to cover that siren coverage area for us. That's called backup route alerting. So we actually practice this with a lot of our local fire departments, and they're graded and tested when FEMA actually comes for exercises. So that concludes my presentation. Hopefully you got something out of this today. It's a little different, but again, I appreciate you guys and all that you provide and help us with. We're looking forward to getting back with you to let you know soon on what the decision may be as far as with our upcoming exercise on September the 15th. And I'll turn it back over. Thank you.
Thank you, Jerome. That's excellent. I just want to add a few things for our Citizen Corps and Medical Reserve Corps to what Jerome was reminding us of. When there is an actual emergency or a drill, you really, as a volunteer, you do not report unless you are called upon to report, either with a phone call, through Ohio Responds, or through the Vesta Alert. So number one, never just show up at the EMA because you heard it's activated. Number two, Jerome, and we're having this wonderful training here today with lots of really great information. However, if you're looking to get caught up on your National Incident Management or FEMA, FEMA has a great website you can go to, and you could do your NIMS 700 or NIMS 100, 200, 300 if you want. You're stuck at home, you're bored during the day, or it's a rainy weekend. Don't be afraid to go on and catch a free FEMA training, and you can always email your certificate to either your Medical Reserve Corps or your Citizen Corps contact and let us know that you've done that training, and we keep those usually on file. So just a few updates if you're looking for something to do. And thank you, Jerome.
You're welcome. Thank you.
We would prefer to see your shining face in person and see you and get all those wonderful treats you always throw at us and the wonderful meal you provide us. Hopefully soon.
All right, thank you so much, Jerome. We appreciate it. So up next, we'll be hearing from Dawn Cole, who is the Emergency Response Coordinator for the Lake County General Health District, and she's going to be talking to us about points of dispensing. Dawn, I think you should be unmuted. Let's see if we can hear you.
Yeah, okay, can you guys hear me?
Yep.
Sound good? Everybody?
Yep,
thumbs up? Okay,
Yep.
Very good. Okay, well, yeah, good evening, everybody. And as Jessica said, my name's Dawn Cole. I'm the Emergency Response Coordinator and one of the Public Information Officers at Lake County General Health District. And we're going to talk a little bit about PODs, or points of dispensing, which are better described as mass vaccination or mass distribution clinics. And if you worked at one of our PODs in the past, as in H1N1, well, first of all, we'd like to thank you for your service. And if you're new to PODs, this is a general introduction to traditional POD concepts. So, and you can see in that picture there that some of our volunteers working during H1N1 at the Willoughby Middle School. Now it used to be the high school, as I mentioned earlier. But this is a general introduction to traditional POD concepts. And we've had some conversations with our fire departments about opening PODs when a vaccine becomes available for COVID-19. But as we're going to discuss a little bit later, we will most likely not be able to use a traditional POD model when it comes to the vaccine. But this presentation is going to give you some concepts that are mostly universal to any POD. And next slide, Jessica. So POD, P-O-D, stands for point of dispensing, and it's a location where vaccines are administered or medications are dispensed to a large population in an area that's been affected by an emergency. And in Lake County, the public may also be coming to a POD to pick up non-medical goods like food or water, and it all depends on the type of emergency. Next slide. So if a pod is activated due to a public health emergency, many times the medication dispensed or the vaccine administered will come from the Strategic National Stockpile, or the SNS, which is our national repository of antibiotics, vaccines, antitoxins, and critical supplies or medical equipment. And it's designed to supplement community supplies when they run out. And you heard Joe mention a little bit about SNS, and you may have heard a little bit about it in the news, because we have been receiving several shipments of masks, gowns, face shields, other personal protective equipment, or PPE, from the SNS in response to COVID-19 for our hospitals, our nursing homes, and our first responders. Next slide. So much of our planning for pods is based on responding to an anthrax attack as a worst case scenario, because after being exposed to anthrax, a person usually has about 48 hours to start receiving antibiotics before they'll become ill. Next slide. So in Lake County, we have pod plans that cover tasks such as transportation, security, and dispensing. And planning for a pod is a joint effort of the Health District, Lake County Emergency Management Agency, the fire departments, law enforcement, and other agencies. And we have 6 pods in Lake County that are located in Kirtland, Mentor, Wickliffe, Willoughby, Painesville Township, and Madison, with a backup facility in Perry. And pods could be open due to a bioterrorism event, a natural disaster, or infectious disease outbreak, as we did during the H1N1 outbreak. But it's always that decision amongst the Lake County General Health District, the Lake County Emergency Management Agency, and the Lake County Commissioner's Office to actually activate the pods. Next slide. So this is an example of a traditional layout of a pod in a school gymnasium. And when you enter the pod, as you can see those first green arrows there, there are several stations that each attendee must visit in order to receive their vaccine or medication in a controlled manner. And there's intake, screening, dispensing, or vaccination, and finally exit are the pod stations that were suggested to have it at a minimum. But there can also be a decision to have additional stations such as translation, education, access and functional needs, and other areas depending on the nature and the emergency and the needs of the public. But now looking at this layout, you're probably already starting to think about why this type of model would be problematic for COVID-19, because it calls for large amounts of people to stand in lines for extended periods of time, so social distancing wouldn't be practiced. So even though we have some ideas about what it might look like, we're actually going to task and ask all of you volunteers for ideas about how we might safely deliver the vaccine in to large amounts of people using social distancing. And quite honestly, all ideas are welcome, and I'm actually including my information at the end of the presentation to encourage you to contact me with your ideas. Next slide. So our current plans include some alternate dispensing modalities, including a door-to-door distribution plan for one community if the medical countermeasure is in pill form. And several of our pod plans make concessions for drive-through distribution or vaccination. And this is the idea that we've been tossing around mostly when it comes to the COVID-19 vaccine. But as you can see in this picture, there are some definite considerations that we would still need to make, like the use of personal protective equipment. And in addition, we also work with individual companies to become closed pods, which are pods that are planned for and staffed by a private company or an agency and that are open only to their employees. Next slide. So if the public health emergency doesn't involve a vaccination and is only serving to distribute goods, the state of Ohio allows the use of a head of household to pick up medication for up to 20 persons without those individuals being present. And you can see how this arrangement would take a significant amount of stress off of each pod. And the person picking up the medication, if they're picking up medication, would need to have specific information on each individual that they're picking up for, including weights and allergies. And we would most likely ask that a person provide this information or complete paperwork for each individual before they would come to the pod. Next slide. So when you arrive at the pod as a volunteer, you'll be assigned a position and given a job action guide. And that job action guide outlines the goal of the specific position, qualifications, and trainings that are required before a person may be put into that position, and any equipment that would be necessary to complete your job. So it essentially serves as a just-in-time training for the position. But we do want everyone to know that if you, as a volunteer, you will never be assigned a role that you're not qualified for or that you don't feel comfortable taking. Next slide. So we're going to take a few minutes to talk about the duties of the pod core management team, which is defined as the pod supervisor, the pod safety officer, a site security manager, logistics unit leader, and the pod public information officer. Next slide. So the pod supervisor provides overall direction and control of the pod site, and they make sure that all operations are completed in a safe and timely manner. And they're in constant contact with their pod leads to track vaccine usage and current supplies, and they request resupply of materials through logistics, and to make sure that the pod has everything that it needs to complete its mission. And if the pod supervisor notices that the floor plan being used isn't allowing people to be served fast enough, they can contact the branch director and consult with the incident commander to determine how to make the process faster. And the incident commander will also be able to give advice on what steps must be maintained for legal reasons. Next slide, please. So next, the pod safety officer, who recommends safety or security personnel. They ensure safety of the clients and the staff while they're at the pod site and provide personal protective equipment to staff as needed. And the pod safety officer is responsible for overseeing the disposal of biohazardous waste, if there is any, and documents any accidents or injuries to clients and to staff. Next slide. The site security manager should be a law enforcement officer who has the ability to supervise a security staff and maintain the security of medications and supplies, and they oversee traffic control so that people can safely arrive at and leave the pod. Next slide. And the logistics unit leader, they coordinate materials and personnel to properly run the dispensing site, and they'll also oversee and maintain the order of supplies and equipment. Next slide. So the pod public information officer or PIO, they're the point of contact for the media at the pod. And sometimes a pod will have a specific area to welcome the media, and sometimes it won't. But members of the media should always receive an escort to accompany them at all times while they're at the pod. Next slide. So there are some things that you'll want to know that may help you into your decision to work at a pod in case you should be called upon. If you could go to the next slide, Jessica. So we've talked a little bit about notification today, but if you're needed to work at a pod, first of all, the county leads are going to be notified. And the leads are individuals who fill key positions that are crucial to managing an emergency that requires the opening of pods. And they include both public health and non-public health staff. And in Lake County, the leads are notified through that reverse 911 system that Jerome mentioned called Vesta Alerts. And you've already heard tonight that your volunteer leads in Lake County, they're Kristen Kane, Haley Russo, and Marianne Rusnak, and very soon, as Jessica mentioned, Tammy Spencer will be another one. But they're the ones who would be contacting you. As Kristen said, do not self-deploy. They would be contacting you first with a request to lend your talents to the pod, but they're going to tell you exactly where to report to as well. Next slide. So one of the perks of staffing a pod is that before they open, you and your family will receive medication, vaccination, and anything else that the pod would have to offer, because we don't want you to worry about your family's health or safety during an emergency, and we need you so that everyone else can be taken care of. So it only makes sense that you would be one of the first ones to receive material given out at the pod before it would open to the public. Next slide, please. So in closing, and just to give all of us a reality check as to the task at hand for running a pod, if we take a Lake County population of roughly 236,000 people, and we put that through our 6 pods, that would mean that approximately 39,400 people would be served at each pod. And that equals the approximate populations of Paynesville and Eastlake combined going through each pod. So worst case, we would only have 48 hours to get all of those people through each pod. And if we're talking about vaccinations, best case, and I'm sure this is very optimistic best case, one person can vaccinate 60 people per hour, according to one of my friends who's a nurse. So that would mean that we would need at least 14 vaccinators for the pod, in addition to people to help with filling out paperwork and directing traffic and all the other activities that must still be performed at the pod. So really, when you start to think about this really is quite a feat. Next slide. So in closing, we do want to take the opportunity to thank everybody for taking the time to take this training today and to help us to complete this mission. And, again, if you have any ideas about how we could think about the COVID-19 vaccine and how we could best and safely deliver that to the public, please give me a call. And thank you, everybody.
Hey, Dawn, it's Kristen.
Sure, Kristen.
I know a lot of the Medical Reserve Corps and Citizen Corps volunteers that are participating this evening were with us during H1N1 and probably did have some experience helping with either registration or what have you. Now, how do you have any clue like how similar or dissimilar that this COVID experience may be versus H1N1?
Well, again, when you think about that H1N1 experience, and we all remember people lining up early to get their H1N1 shot. We remember people being at the different stations, standing in line for a while. So if we think about that possible drive-through concept, even though I can't even say that for sure, but if we're thinking about that, registration, those types of things may need to happen early, before the person even comes. And I've been speaking with a couple of physicians from different hospitals, and they were talking about possibly even having people make an appointment before they would come. But these are all things that we need to talk with our fire chiefs about, because they're the ones who are the pod supervisors. Of course, they want to keep their staff safe as well. But yeah, this is going to be a lot of conversations starting now up until, well, I shouldn't even say starting now, starting several months ago and up until this vaccine actually gets here. So yeah, again, if anybody has any ideas, since most of the people here are medical, you guys do this every day. You take care of many, many people for a living. So I'm sure that there's going to be some great ideas that come out of this group.
I sure hope so.